Okay, we'll start over. Welcome to our webinar, Tyze Personal Networks. This is a joint presentation by the Alzheimer's Society of BC and Tyze. The workshop today is a joint presentation as well. So we're going to have our very own Kern Windrace doing part of the presentation. Kern is familiar to most of you, perhaps all of you, depending on how many volunteers we have signed in today. She has been with the Alzheimer's Society for many years. She refuses to say how many. And her current position is Regional Services Manager, and she supports field staff in the delivery of our programs and services around the province. She also writes fiction, and she claims highly questionable poetry and is trying with mixed success to learn how to knit. I think she's preparing for retirement. Kern will be talking about why the Alzheimer's Society of BC is partnering with Tyze in the first place. And then later on, she'll be talking about what this means for you, for staff, for volunteers in terms of our partnership and how we can promote Tyze to potential users. Our guest today is Natasha Moore, and she is here from Tyze Personal Networks. She is an engagement manager at Tyze. Now, before anybody gets excited and thinks they've got weddings to plan and Natasha can help out, sadly, this is not what the job involves. She's been with Tyze for over 2 years, born in Canada, grew up in Australia, and is a triathlete. So stamina not an issue here today. She'll be talking about the difference between social networks and personal networks, what Tyze looks like, what it can do, and how people can use it to coordinate support. Now, the way we're going to do the webinar today is we're going to mute you all until the end, but I noticed there is a hand up. Julie and Kara have their hand up, so I'm going to unmute just for 1 minute just to see if there's any questions, if there's any problems, if anybody is having any trouble hearing anything. And once we've cleared that up, then we'll mute you and have questions at the end. So just 1 sec.
All participants have been muted, but you may unmute your line by pressing *6.
So Julie and Kara, your hand is up. If you have a question, if you could just press *6. And, or if anybody has a question before we start. Questions, Julie and Kara? I'm assuming that means no. Okay.
Hi,
we'll go
it's
back
Mariel.
to hi.
Hi. I can't get into the website, unfortunately.
Well, you know what? Part of the problem is sometimes people start out with www. It's not. So if you're typing in the web address, just put momentum.adobeconnect.com/AlzheimerBC.
Oh.
Period. You don't need
Okay.
you don't need www, and if you use it, it won't work. That should get you there.
Okay, I'll try. That was
Okay,
what I was doing, but yeah.
Yeah, just the passcode after that. Did that get you?
Okay. Yes, thank you.
Good.
Sorry about that. Okay.
I'm going to unmute you again.
Windows control click. Okay, bye.
Oops. Okay, telephone problem. All right, I'm going to pass this over to Kurt. Okay. There we go.
Now, I know some of you are more familiar with Tyze than others, and some of you took some training in how to actually use the site and get families signed up. I'm not going to go into a lot of detail or any detail at the moment about exactly what Tyze is. Natasha is going to do that in a few minutes. What I'm going to do is talk a little bit and very briefly about our partnership with Tyze. And we were really excited to be approached by Tyze. We were really excited by the tool that they offer. It's an online personal networking tool for families, and that's basically what it does is it helps families stay more closely connected. And there are other services out there, and quite a few other services that are similar to this, but we chose Tyze for some very specific reasons. We mentioned here that we received funding for it, but that wasn't it wasn't the only consideration, and it wasn't, I would say, even the primary consideration. We really believe in the philosophy that Tyze has. They're person-centered. The support networks that they're offering are built around the individual who has the diagnosis of dementia. They are a company that's based in Canada, and that's really important to us because people who use these networks store private information on them, and we want any service that we're recommending to people to be in compliance with Canadian privacy legislation. They have a solid reputation. We know that they've been really involved in guardianship issues around in building support networks for people with disabilities, and Barbara Lindsay has worked closely with Tyze on a variety of projects in the past. And they're recognized and supported by the Ministry of Health, both Home and Community Care and mental health. And so they came extremely highly recommended by a number of sources. So that meant for us that they have the integrity and that solid reputation that we knew we could count on. We received funding for this project, and ordinarily families would be paying $129 a year, something like that, to have their own network. We are able to offer this service to a limited number of families, but we're not too worried about that particular number at this point, for free. We received funding to do that, so we're pretty excited about that. We have several families who've signed up already, and we're hoping that you will, in your work, go out and recommend this to families that you think it would be appropriate for it. We're hoping that you'll mention it. We'll talk about that a little bit later on, about how you might be able to go about promoting that. We see that Tyze is not, I should be moving ahead here. It's not a replacement for any of the services that we already offer. It's an extension of the services that we're providing. Okay. Can we just, there we go. And one more. Okay. So basically, it offers an online suite of tools to enhance communication and information sharing with families. And we've all heard that families sometimes have a difficult time staying connected with one another, with their network of support. Actually, this part I think I'm going to leave up to you, Natasha, because we were talking about special software and things like that, and it's not, nothing special is required with this. You can just, it's an online tool. Sorry, I kind of got distracted there, but yeah, and the way we look at it is anybody who can use Facebook can use Tyze. It's easier, much easier to use than Facebook, and we use that comparison because even though this tool is nothing like Facebook in that it doesn't come with all the weird ramifications and garbage that Facebook comes with, it's a social, it's a networking, an online networking tool in the way that Facebook is. Like if you can use Facebook, and if you have families who are using Facebook, then chances are really good those families will be benefiting from using a tool like Tyze.
Is that my cue? My cue? I think that might be my cue.
Yeah, that might be your cue to Natasha.
Yeah. So thank you, Ken.
Yeah, it was interesting.
So I mean, I'll go through a little bit of the same, sort of ideas and concepts around Tyze to give you an introduction to where we come from and the work that we've been doing for the last few years. So we are a social mission business, which means that while we are a for-profit company, at the core of what we do is a social mission, and that's really around a way to describe it is really around affecting a shift to a network model of care. So to providing a tool that supports families to connect and contribute to the health and care of each other. We stem from our Planned Life Advocacy Network, bit of a tongue twister, which was established 20 years ago by families with children with disabilities who are really struggling with the notion that their children may outlive them and the care that they've provided wouldn't be there. So they began an organisation that really looked at forming social networks, groups of people, of friends and family that we in some ways take for granted, that they actually created them around individuals with disability. And Tyze became an online tool that supports that creation of a social network around a specific person and a specific situation. And so, we've really moved now from being very much located in the disability area to being a tool that is actually used by many different people for many different reasons, but a lot of it is around that connection, communication, collaboration, and very much focused on improving health and social outcomes. So it's a practical tool to communicate. So it has all those different elements and features that you would expect to find in a tool that really allows the extension of communication and collaboration. So that's a calendar and a way to ask people for help and support through tasks, and a place to store information, whether that's public information is in public to the network, or private information just for a few people. And unlike a lot of the social networks we use now, it is totally private. So it is just the people you invite in. Nobody knows that you have a Tyze network. They can't go and search for you and friend you. It is very much all about the people you invite. And so, as I mentioned, we have really expanded from being very much focused and located in the disability community to being to having individuals who use Tyze that are from a variety of different illnesses, areas, or situations and life experiences. So that might be disability, it might be injury. I broke my elbow 2 years ago, and I had a Tyze network to just kind of communicate with my friends and family. I have friends and family in Australia, and just to keep them up on the things that I was doing and the silly experiences I was having with having a kind of cast and not being able to move my typing with one hand. So it actually can be quite useful for people who need to communicate across a geographical distance, so sharing potentially with friends and families in other countries. So we have around 8,000 users worldwide, and we work with about 30 organisations across 4 countries. And each of our networks is unique. They're unique in size, they're unique for their purpose and their reason, and they're unique in what they do. And that uniqueness, so as I mentioned, it's very much about, can be very much about different, say, illnesses or life circumstances and experiences. And sometimes it's actually just about what sort of information we want to share and who we want to share that with. So we certainly find that people use Tyze to coordinate care. So they use it very much to communicate with close family and friends about getting rides somewhere, about keeping information about health and conditions in one secure place. Just about updating people and saying, this week has been like this, and I have chemo coming up next week. And we also find that support groups use it to communicate with each other outside of that one-on-one interaction, or that they also use it as a way to convene support groups that are spread across a distance too. And organisations use it to share information, to organise meetings, to keep documents safe and secure somewhere. So lots of different ways that people do use Tyze. And I think it's it's really important to sort of point out that Tyze is quite different from social networks. So it's not about following and status updates. And so I love this little cartoon because he says, "Hey, follow me," doesn't mean you have to follow me everywhere. It's so cute. They're all sitting there. And, so I mean, it is quite different, and that's not to say that it's not used as well as, or it's used instead of social networks, but that it actually can be used for a different reason and different purpose. So I have a Facebook account. I have Twitter. I don't really tweet very much. I don't have much to tweet about, and I have a few other of, the various social medias that are out there. But the distinction here is really that Tyze is private, and I know you can create Facebook groups. I'm in a Facebook group, but there's no advertising. So when I go onto my Facebook group, there's lists of things everywhere. There's all kinds of things happening. So this is very much intended to be private and personal, and it's not data mined. So we won't, show you some advertising for, wedding dresses when you change your status to engaged. Nor will you get sort of, and now the latest one with Facebook, they look like somebody's posted to, but they're not posts. They're actually suggestions for posts you should like because they're actually companies. So that sort of stuff doesn't happen in these spaces. They're really very much about what you want to do with the close people that you've invited to it. There are some, I think, some important distinctions between Facebook and Tyze, and certainly one of them is advertising. Privacy is another one. Somebody told it to me in a really great way just the other day, and they said, the one reason for me in not using Tyze with my mum was because I just didn't know when they would change their privacy settings again and how they would change it. So you kind of got to be on guard all the time to sort of work out what's happening and what's going to change. And they use the information that you put in there. So when you're putting your information in, they take the rights to that information to use it in any way that they see fit. So as I mentioned, I have a Facebook account, so it's not about saying that Tyze is an alternative to Facebook, but that it has different intent and purpose. And so I'll go through what a Tyze network looks like and some of the things that you can do with the Tyze network. So it's, as I mentioned, it consists of a number of tools and features that support communication coordination. So the first page you come into is the Connect page, which provides you with an overview of the activity in the network. So this is a network for Anne, and Anne has recently had a fall. And so the group has come together to share information, to communicate and organize as well. So she's her birthday soon, they're organizing a potluck, and they've got some collective information there about her home care team. So this is just the most recent sort of things that are happening in her network. The calendar feature enables the group and enables everybody in the network to post events. And there can be events that are just notifications of activity that's happening, or events that you want to invite people to. So Anne's birthday potluck would be placed in the calendar as an event that people can RSVP to. She has some physio that's coming up and may require rides to physio, and so that would be placed into the calendar as well. And then using the contribute section, that a request for support around that would be placed. So Anne needs a ride to the a physio appointment, and Matthew's helping out with that. So it's a really lovely way that quite gently and easily individuals within a network can ask for the help and support that they might need. And then on the other side, the people in the network can again, like really easily and gently say, yes, I can do that and I can contribute to that. So it's there's a lovely reciprocity there, and there isn't that feeling of obligation. I really should be doing something, but it's more like I know where I can help and know what I can do, and I know what help is needed, and you can match those two together. And then stories and photos is really about providing a bit of soul and a bit of potentially humour into the network. It's a place that stories can be told, whether it's about family, whether it's about the individual themselves, or whether it's about the people that are in Australia that are on the network and they're sharing things that they're doing as well. So it really allows a bit of connection beyond very simple updates or messages, and beyond some of the more nitty-gritty of organising. So a little bit of a heartbeat of the network. And then there's two spaces that files can be uploaded. So there's shared files which are available to everybody, and then there's also the vault files which are locked down. So you need to be given permission to access the vault to access these files. So they're a great way to provide information and resources appropriately. So shared files you might use to upload emergency contact information so that everybody has that information quite easily and quickly. It might be somewhere that you put healthy food ideas or recipes if you're asking people to help out with meal preparation. And then the vault is a little bit more personal. It might be about insurance information banking. It might be lawyers' information, and if there's advance directives, and if there's reticence in putting that information up there, which is totally understandable, a really nice alternative that a number of people have told me they've used is actually just to put information in there about where that information is, so that you don't have to say, okay, this is my lawyer and this is his phone number, but you could have that somewhere you could have it locked somewhere in the house, for example, but just let people know that if, in a case of emergency, they need to find some of this information, that's where it can be found. So it becomes quite a powerful tool in that way. I realized a couple of weeks ago when my boyfriend was not home and is late, and I'm thinking, I wonder why he's late. And I don't worry about that sort of thing, but all of a sudden I had this moment of, I know his will is in the freezer, and that's all. That's all I know. I know no more. I'm serious. It's in the freezer. It's a great place to keep it if you need it. The passport's there too. But I know nothing else. I don't even know his mum's phone number. I could email her. Please come to the door, and I'm emailing her saying so. So it really struck me that having that kind of information is incredibly important for the people that are closest to us. And doing something like this, just providing that information in a safe place where we can all access it at anywhere, as long as we have an internet connection, I think it gives me certainly a really lovely peace of mind. So I mentioned some different ways that we see that people use Tyze. It is very much a tool for communication. So there are different modes of messaging within Tyze. So you can send an urgent message if you really need people to be alerted to something. You can send some quick updates, and then the people who are part of a network can send messages of support. So lots of lovely different ways of getting information out to people. We see a lot of people using the calendar not only for appointments but also for social events, for important dates, to put up things like respite schedules. That contribute function connected with the calendar is quite a rich, there's quite a rich combination of tools. So you need to organise a meal train we have women who set up a Tyze network when they have a baby, and so they've got all the information about what's going on in there. They're posting, they're 2 o'clock in the morning, but then they're also able to put up things like a meal train. So maybe every Wednesday a friend comes and brings a dinner. And so you could schedule that both in the calendar and then also get each of those individual friends to take a day that they're coming to bring a meal. Scheduling visits, whether that's in the hospital or in the home, organising rides to appointments, organising rides to hospitals, all of those sorts of things can be done using the contribute section. And certainly stories, not only can it be personal, as in, the network's for me and I'm writing the story about myself, but a really lovely way for family and friends that live at a distance or that just haven't been in touch for a while to put the things that they're doing as well on the network. And we also had a family in Nova Scotia who, the caregiver, her mother had an early diagnosis of dementia, and she started using the stories and photos as a way to record her history, her mum's history, and just family events and things that were important. And each week they'd sit down and they'd go through all the stories. And so it was a really important way that she was enabling her mum to remember things in her life and help her with that kind of ongoing practice of thinking and remembering and telling stories. And it was quite a powerful tool for her and her mum. But they'd actually also then connected the rest of the network to that history. And they have a couple of grandchildren somewhere else in East Canada that then decided they were going to create a book. And they created this book about Grandpa, because all the stories about Grandpa. And they were going to give it to their grandma. So it's a lovely way of not only creating an exercise for somebody, but actually sharing family history. So a really nice use of stories and photos there. And then the files, as I mentioned, there are definitely different ways that you would use shared files and the Vault files differently. The Vault is definitely a space for things like care plans, financial information, for thinking about time in the future, like I mentioned before, for thinking about what information do I want the people closest to me to have if something does happen. Put that in the Vault, let them know it's there, and they don't need to think about it again. But then also the shared files, what sort of contact information or emergency list do people need? What are recipe ideas if they're helping me out with meals? What are some medical information or health information that others might want to have access to as well? So really, there's lots of different ways to use Tyze, obviously. And it will really, it'll be very unique for each family. And I think certainly one of the things we find that people struggle with is sometimes communicating how it could be used or how it is useful, and it can be very much connected to the individual situation of the family. And so having some of these sorts of ideas in your mind can be really useful to say, well, didn't you mention that if you have some friends who are coming to walk the dog, you could pop that onto Tyze and get them to just contribute to that, and then if they can't, other people can come and help out. So just different ways you can think about talking with people about using the tool. And I wanted to touch on this just a little because I'm a little bit of a planning and strategy nut. I like to plan. I have lists. My mum and I we do a Christmas party, and we all just like before we even do anything, we have lists and lists and lists. And I love my lists. And so I think these two elements do really matter. I think they're quite important, but they don't need to be heavy-handed, but I think encouraged. And so it's something that I definitely encourage people that I talk with starting networks, or if they're struggling with getting their network up and running, or they're not quite sure what they want to do with it. It's just to take a step back and have a little think about a little think about the strategy or the plan that you want to create. I think it's because these communities are very purposeful, and so if you're not going forward with a purpose or creating a purpose out of them, then they do become a little ineffective, I suppose. So there's some simple components within the networks themselves that help and support that development of that knowledge. So it has a network name, but the networks all have a purpose as well. And that purpose communicates the intent of the network to the community of people that you're gathering together. And I think it's also quite important to, before you're setting up or while you're setting up the network, to think about the different things you would like help with, and then start to integrate them into your use of the tool. And it's definitely connected to the purpose. My purpose is, so my network was around my elbow, and so I couldn't do much cooking. I tried a few times, not so successful. And so friends came and brought me different bits of food, and so I scheduled that through the network. I needed help and support around the house, and so people kind of came and helped me do those sorts of things. So it just provided a way for me to think about what it is that's happening for me, what help and support do I need, how do I translate that into actual components on the network itself. So I think a little bit of thought there can be really important.
Thank you, Natasha. That was great. So what does that mean for our volunteers and staff? I think just even listening to what you were talking about, Natasha, it's clear that the people who would benefit from Tyze would be most of the people that we serve who actually have access to the computer and are comfortable using it. People with dementia who are early enough in the disease that they are able to manage their own care and are comfortable using the computer can set up their own networks and then invite their family members and friends and the rest of their support network to join in. Family caregivers can do it whether they're the primary caregiver or somebody else in the family. The extended family and friend networks, everybody can benefit as long as the network is built around that one individual. One of the things that I would suggest that when you're thinking about who might benefit, it's not necessarily the person you're talking to right there. I mean, if you're talking to a family member or a caregiver, a spousal caregiver, for example, who's really struggling, feeling isolated, not able to ask for help, not comfortable asking for help with particular tasks, this might be a really good opportunity for them to involve their adult children, to get one of their kids to set up the network and pull in other family members, pull in other friends, so that if she wants to attend a support group, she can put that up, or her daughter can put it up on the contribute page saying, Mom really wants to attend the support group on such and such a day. Is anybody able to come over and sit with Dad for a while? So it can take the onus of providing all the care off the shoulders of the one person, or it can take the onus of asking from the person with dementia as well. It really simplifies that communication. We know that people have a real struggle sometimes asking for help, and this makes it so much easier for them to do it. We know also that families, even when they're living in the city, in the same city, can feel really far apart from one another. They have a hard time connecting. People who lead really busy lives. It's the same as almost as if they're across the country or in other countries entirely. But anybody in that family network can participate in care through a tool like Tyze, because they can have the conversations, they can share the stories, and it's a way of communicating really quickly, really easily with an entire group of people.
We actually find that that providing that information creates deeper connections when people do actually talk to each other. Yeah. And so we've had networks in which, particularly in the disability sector, networks for those with a disability, it allowed friends and family who were at a distance to just see what's going on in the life of the centre, and rather than when they're talking on the phone, ask questions that were difficult for that person to answer, they're able to phrase it in different ways that actually grew a conversation out of it. So they knew that they had just recently gone to the zoo, and they could ask them more about the zoo and rather than saying, well, what did you do today, which was harder. So and the information is just information. It's just putting up a message saying, this is what happened, this week. But it's a really lovely way of connecting people with sometimes that connection is hard to make.
I also see it as a really good way of pulling the children and teenagers in a family into the circle of care, because that's often difficult in families, either because the kids don't know how to talk to the person with dementia, but it's a way of sharing stories, sharing pictures, sharing the celebrations and successes with one another. And kids are really comfortable with social media in a way that often their grandparents aren't. So it's an opportunity. And especially if families are living spread out across the country or across the province, it's a way of pulling people together as that group. Now, if you're thinking when you're talking to people about how you connect them with Tyze, we are asking that you not send people directly to the Tyze website, because they'll then be signing up and having to pay the $129. Whereas if they connect through the special link that we have, then they automatically are exempt from that fee. We do have a private link, and we will be sharing it with our staff at the resource centers. So if you're a volunteer, connect with your resource center to see how this is going to be handled in your area. In some places, volunteers might refer people directly to Tyze and have the link. In other areas, it'll work a little bit differently. So talk to your SEC or your First Link coordinator or your Minds in Motion coordinator to see how it's going to work in your area. And when you do get that link, it's not to be publicly advertised, because we want to be able to have those conversations with people to make sure that this really is the right tool for them. Before we just go throwing it out there willy-nilly, we want to make sure that the families who are signing up are actually families who are dealing with dementia, and are the families that this is intended for. So we're seeing that if you facilitate a support group, this would be an opportunity to bring up this particular tool. I know that in Vancouver, one of our staff people went out and visited all the support groups and had conversations with the whole group, and several people expressed an interest and have subsequently signed up for with Tyze. If you're delivering education, we have brochures from Tyze, and we also have a handout that we've prepared so that to give you some talking points. We have presenters notes to give you some talking points on how to explain Tyze to families, and then we have a handout that you can give families so that they can get a sense of what it is for themselves, as well as giving them the brochure. If you're doing one-on-one support or doing support calls, it's an excellent time to sort of suss out whether you think this is a useful tool for the person. And if you're in doubt, you can always ask. You know, like it's a simple thing just to ask someone if they think someone in their family might be interested in setting up a network like this. It doesn't necessarily have to be the person, and I'm stressing that because I know that when we've talked about this in the past, some of you have said that the families that you deal with are primarily elderly and not actually on Facebook or using websites, but their adult children often are, and it really, you know, it's whoever in the family is most likely to be able to pull the rest of the family together using this tool. That's the person that you're going to be targeting when you're thinking about it, and you might have to do that through somebody else. But if you're talking to people and you are getting the sense that they're having some struggles providing the care, that their family is feeling a little bit dispersed and they're feeling isolated and they're feeling like they're not able to reach out for help from the people who they consider to be their support network, this is an excellent tool to be offering them. As I said, we have the handout, we've got the brochure. Natasha is willing and able to answer any questions you may have after this call and during this call. So if you go away and you think about this and other questions come up, you can email her, or actually email Jan, because Jan's going to be collecting all the questions for this. We figure that if one person has a question, other people may benefit from the answer as well. And you know, if you want some more information on how to get your family set up, talk to your staff people, and we will be following up with the staff who are on this call.
And I think you know, I think it's wonderful you mentioned that element of stress that can be occurring for a caregiver, and so it's not necessarily about saying to them, look, this is a tool that you could use, but finding potentially different avenues to find some of the people who are doing some of the other support to enable that increased communication and information sharing. And I think there is this sort of, the story I mentioned before, you know, sort of showed that intergenerational communication that can occur in the online space, even when people aren't used to and experienced with online or with social media tools. So even though certain family members might not use computers at all, you know, there actually is an opportunity, and it's a really interesting opportunity to learn more about it and potentially actually gain some new experiences by doing so. And so we had a little story about a family who, so they had set up a network, but the grandparents weren't on the network. And I can't recall who the network was for now. I think it was actually for a daughter. But the woman who was a caregiver would take the computer over to her family and just show them, like, oh, look what's happening here. Isn't this nice? And she'd do it because she wanted to show them the information, but she also actually wanted to encourage them to let some of that apprehension go and try it. And they saw how easy it was, and they could just see some photos of their grandkids, and gradually they were doing it themselves. And it opened up to a new experience around doing it. So, I mean, that certainly might not be the kind of situations that you're working in, for sure, but there things like that happen, you know, and it is possible. And so I think if you can be a little bit mindful around the different sort of experiences that people might have and a different sort of support that people might have, then you've got an opportunity to tap into that a little bit.
And I really like what you were saying earlier about this tool being about connection and collaboration. It allows every member of the family who's part of that network to be participating in the care of the person who has dementia. And I think that's huge.
Yeah, and in a way that's appropriate for them as well. Like it really allows this sort of, well, I can't do too much, but I want to do something. Or I actually just want to read and know what's going on. So if when things get a little harder, I'll step in. And so it really opens up that aspect of information to everybody.
And I think different families will find different aspects of Tyze to be more useful for them. For some people, it's going to be the contribute part where you're getting help with some of the tasks and the activities. For others, it might be the calendar and bringing the family together that way for events. And for others, it's going to be the stories and the celebrations.
Yeah, definitely.
And the document sharing.
I'm just going to advance the slides here. We do have information on how you can get more information, and that's on the slides. The handouts that are on the screen are the one that says Tyze December 5th is the PowerPoints, and the rest there is a brochure as well as a couple of documents from Alzheimer's